Good afternoon, students. The topic for today's dissection is the back and the scapular region. For exposing the back, first of all we have to mark the incisions. You can see over here the first incision is the midline incision, so which will extend from the tip of the C7 vertebra and extends vertically till the T12. But we have extended this incision till the lumbar region to expose the muscle of the back, that is the latissimus dorsi. The second incision is on the neck, which is extending laterally from the tip of the C7 vertebra till the tip of the acromion process. The third incision is inferiorly, which is extended from medially from the lumbar vertebra till the anterior superior iliac spine, which is curved laterally. So now we will reflect the skin laterally to expose the muscles of the back and the scapular region. So this is the muscle of the back and the scapular region. So as the man lie on his back mostly, so the skin and the superficial fascia of the back is very thick, and the superficial fascia of the back contains abundant of fat, because it has to sustain maximum pressure when we lie down. So now we will do with the muscles of the back. As you can see over here, there are two large superficial muscles. Number one is trapezius. You can see this is the trapezius muscles. This one is the trapezius, and the second large muscle, this is the latissimus dorsi. This big muscle is latissimus dorsi, which is connecting the lower limb with the upper limb. You can see this large muscle, it is connecting the lower limb with the upper limb. First muscle that we are dealing with is the trapezius. The trapezius are on both sides. This is the one half of the trapezius. With both sides it will make a trapezium shaped muscle. The right and left muscles together form a trapezium that covers the upper half of the back. You can see the upper half of the back is covered by this muscle, that is the trapezius. The uppermost fibers of the trapezius are not exposed yet because we have to preserve it for the head and neck dissection. That we will do later on in the head and neck part. Now coming to the origin and insertion of the trapezium. So the points of origin for the fibers of the trapezius are: first is the external occipital protuberance, the protuberance which you feel on the back of your head. This is the external occipital protuberance. Then curving from the external occipital protuberance, there are two lines which are marked on the skull, vault of the skull. These are the superior nuchal lines. So the fibers are taking origin from the medial 1/3 of the superior nuchal lines. Then third is the ligamentum nuchae. There is one ligament that is extending from the external occipital protuberance till the C7 in the midline. That ligament is known as ligamentum nuchae. So the fibers are taking origin from this also. Then the spine of the C7. Obviously the ligamentum nuchae is ending over C7, so the fibers are taking origin from the C7. Then T1 to T12. You can see till T12. This is the origin of the trapezius, and corresponding supraspinous ligament. So in between the vertebral spines, there are spines of the vertebra. So in between the spines of the vertebra, there are supraspinous ligaments. So you can see the origin of the trapezius. So in the midline, it is the origin, and it is inserting on the lateral aspect. Now for the insertion, the fibers are converging on the lateral aspect. As you can see, there are three types of fibers: the uppermost fibers, which are not visible, which are under the skin, the middle fibers, and the lower fibers. The uppermost fibers are inserted on the posterior border of the lateral 1/3 of the clavicle. So clavicle is also not visible over here. So the uppermost fibers are inserting on the lateral 1/3 of the clavicle on the posterior aspect. Now coming to the middle fibers. The middle fibers, they are inserting into the medial margin of the acromion and upper lip of the crest of the spine of the scapula. So here you can feel the crest of the spine of the scapula So they are getting inserted on the upper lip of the crest. Now coming to the lowermost fiber, here you can appreciate very well the lowermost fibers. They will insert on the lowermost fibers are inserted on the medial end of the spine of the scapula. You can see this is the spine of the scapula. On the medial end of the spine, the lowermost fibers are getting inserted. We will do with the second large muscle, that is the superficial muscle, that is the latissimus dorsi. As you can see over here, it covers a large area of the lower back and it is overlapped on the upper part with the fibers of trapezius, lowermost fibers of the trapezius. Now we will do the origin and insertion of the latissimus dorsi. So the first origin is the posterior 1/3 of the outer lip of iliac crest. You can see the fibers are coming from the iliac crest of the hip bone. Then second origin is the posterior layer of the lumbar fascia. The fascia covering the lumbar region is known as lumbar fascia. Then the spines of T7 to T12. You can see the T7 and T12 spines. So the fibers are coming from spines of T7 to T12 vertebra. Then inferior angle of scapula. So in bone part you have already done with the angles of the scapula, the inferior angle of scapula. See, the muscle fibers are originating from the inferior angle of scapula. So this was about the origin of the latissimus dorsi. So now for the insertion, as you can see, the muscle fibers are converging obliquely on the superior aspect. Now this muscle winds around the lower border of teres major. Here you can see the teres major. You can appreciate the lower border of teres major. So the muscle is winding around on the lower border of the teres major and forms the posterior axillary fold. So this is the posterior axillary fold. In the anterior side you have seen the anterior axillary fold, and here you will appreciate the posterior axillary fold. Now this tendon is twisted upside down and it is inserted into the floor of the intertubercular sulcus. So you have already seen on the humerus the intertubercular sulcus. So there are three muscles are inserted on the intertubercular sulcus, two majors and one latissimus dorsi. Latissimus dorsi in between and majors on each side. That is the pectoralis major and teres major. Now we will reflect the superficial muscle, that is the trapezius, to see the deeper muscles of the upper part of the back. There are three deeper muscles. That is the so now reflect the trapezius. We will see three muscles, deeper muscles, that is the levator scapulae, rhomboideus minor and rhomboideus major. You can appreciate these three muscles very well. This is the levator scapulae, then rhomboideus minor, this one is the rhomboideus major. We will do with the origin and insertion of these muscles. First is levator scapulae. The origin is not exposed yet because it will be done in the head and neck region. But I will tell you about its origin. The origin is from the transverse process of C1, C2. C1, C2 vertebra के transverse process. Then second origin is posterior tubercle of the transverse process of C3, C4. So it means four vertebrae are taking part in this C1, C2, C3 and C4. And it is getting inserted on the superior angle and the upper part of the medial border of the scapula. Superior angle you have already seen, and upper part of the medial border of the scapula. Now the second muscle is the rhomboideus minor, which is taking origin from the lower part of the ligamentum nuchae. I have already told you what is ligamentum nuchae, which extends from the external occipital protuberance to the C7. This is the ligamentum nuchae. So the fibers are taking origin from the ligamentum nuchae, C7 and T1. So this is the origin of the rhomboideus minor, and it is getting inserted into the base of the triangular area at the root of the spine. So you can appreciate this is the spine of the scapula. So root is from where it is attached. The root of the spine it is inserting, that is the rhomboideus minor. Next muscle is rhomboideus major. So it is taking origin from T2, T3, T4, T5. As you can see, it is the large muscle as compared to other two. So T2 to T5. The insertion is medial border of scapula below the root of the spine. So this is the medial border of the scapula, and below the root of the spine is the insertion of rhomboideus major. You can see very well. Coming to the nerve supply of all these muscles, first muscle we have done is trapezius. So it is supplied by the spinal part of the accessory nerve. So you all know it is the 11th cranial nerve, that is the spinal part of the accessory nerve, and branches from the C3 and C4 are proprioceptive to this muscle. Then second muscle we have done is latissimus dorsi, which is supplied by thoracodorsal nerve or the nerve to the latissimus dorsi. Thoracodorsal nerve, which is the nerve coming from the brachial plexus. The root value is C6, C7 and C8. Now coming to the deeper muscles, that is the levator scapulae, rhomboideus minor and rhomboideus major. These deeper muscles, all three muscles are supplied by dorsal scapular nerve. The root value of this nerve is C5. In the upper part of the back, we can see an intermuscular small triangular area, that is the triangle of auscultation, which is bounded medially by the lateral border of trapezius. You can see this is the trapezius, this is the lateral border of trapezius, and it is forming the medial boundary of this triangle. Now the lateral boundary of this triangle is formed by medial border of scapula. This is the medial border of scapula. It is forming the lateral boundary of the triangle. Now inferiorly, you can see the large muscle we have already told you, that is the latissimus dorsi. The upper border of this muscle is forming the inferior boundary. So this is the triangle of auscultation. This triangle, it is the only part of the back which is not covered by any big muscle. So the respiratory sounds of the lower lobe are better heard with a stethoscope over this area. Now here we have dissected with the scapular region. This is the scapula and the muscles covering on it will form the scapular region. So we will do with the deltoid. You can see which is forming the rounded contour of the shoulder is the deltoid. The supraspinatus, which is lying above the spine of the scapula, this is the supraspinatus. The infraspinatus, this is the lying on the infraspinous fossa, is the infraspinatus. The teres minor, the teres major and subscapularis, which we will see on the anterior aspect of the scapula. Coming to the origin of the deltoid muscles, it takes origin from the anterior border of the lateral 1/3 of the clavicle, which is not exposed yet. Then the second origin is the lateral border of the acromion process. You can see the lateral border of the acromion process, the fibers are originating. Then the lower lip of the crest of the spine. This is the crest of the spine. So the lower lip of the crest of the spine, the fibers are originating and going to the humerus for insertion. So the fibers of the deltoid, they are getting inserted on the deltoid tuberosity of the humerus. The deltoid muscle, it is an example of multipinnate muscle. Next muscle is the supraspinatus. First we will identify the spine. This is the spine of the scapula. The most prominent part is the crest of the spine, which we feel on the back. This is the spine of the scapula, crest of the spine. The fossa lying above the spine is the supraspinous fossa. So the supraspinatus muscle will lie on the supraspinous fossa. So origin of this muscle is the medial 2/3 of the supraspinous fossa. So this is the origin, and insertion is the upper impression on the greater tubercle of the humerus. So humerus पे greater tubercle होता है, एक lesser tubercle होता है. So it will insert on the upper impression on the greater tubercle of the humerus. Then the next muscle is infraspinatus. So this is the infraspinous fossa below the spine. So the origin is medial 2/3 of the infraspinous fossa of the scapula. This hole is the infraspinous fossa, and from the medial 2/3 part the fibers are taking origin, and the infraspinatus is inserting on the middle impression of the greater tubercle of humerus. On the upper impression, supraspinatus is inserting. on the middle impression, infraspinatus is inserting. Muscle we are dealing with is the Teres Minor. It is taking origin from the upper 2/3 of the dorsal surface of the lateral border of scapula. So this is the lateral border of the scapula. From the upper 2/3 of the lateral border of the scapula, Teres Minor is taking its origin, and it is getting inserted on the lowest impression of the greater tubercle of the humerus. So there were 3 impressions on the humerus: upper, middle and lowest. So these 3 muscles are getting inserted: supraspinatus, infraspinatus and Teres Minor on the 3 impressions of the humerus. The next muscle we will deal is the Teres Major, which is taking its origin from the lower 1/3 of the lateral border of the scapula along with inferior angle of the scapula. This is the inferior angle and this is the lower part of the lateral border. The muscle which is taking origin is the Teres Major, which is getting inserted into the medial lip of the bicipital groove of the humerus, which is not visible because it is covered by the muscles of the arm. So you all know what is bicipital groove or the intertubercular sulcus. So it is inserting on the medial lip of the intertubercular sulcus. First muscle was deltoid, which is supplied by the axillary nerve. The deltoid is supplied by axillary nerve along with the Teres Minor. Teres Minor and deltoid both are supplied by axillary nerve. Then next muscle is supraspinatus and infraspinatus. These 2 muscles are supplied by suprascapular nerve. The root value of the suprascapular nerve is C5, C6. Then Teres Minor was I have already told you it is supplied by axillary nerve. Then Teres Major is supplied by lower subscapular nerve.